Hello, my name is Mr. Scott Geist, and I'm one of the faculty partners here at Cengage. I currently am an assistant professor and the director of the surgical technology program at Pennsylvania College of Technology in Pennsylvania, and I've been teaching here roughly 10 years. So today I'm just going to talk to you a little bit about how I use MindTap in my program. I generally use MindTap for all of my courses. So generally, I require my students to have Cengage Unlimited because I use multiple textbooks, and I'll talk more about that when I get into my course. I think that Cengage Unlimited is a good value for the students, and it actually saves them a lot of money as far as I'm concerned. So let's kind of just get into my system here. So the learning management system that I use currently is Desire to Learn Brightspace. And I'll go ahead and pull that up. Currently, the courses that I'm teaching is Specialty Procedures 1, Specialty Procedures 2, Medical Terminology, Pharmacology as well. For the first years, I'm teaching Introduction to Surgical Technology. So let's take a look at my Specialty Procedures 2 course. And as I said earlier, I use multiple textbooks. Currently for this course, I'm using the Association of Surgical Technologists, Surgical Technology for the Surgical Technologist, 5th edition. And I'm also using Olof and Hinton surgical Mayo setups, as well as Philips surgical instrumentation. And the way that I set up my courses is that I set everything up weeks in a week, week view. So you can see here for the first 3 weeks that we're going to be covering neurosurgery. And then for the next 3 weeks, orthopedics, and then oral maxillofacial, and so on. Generally, the way that I like to run my courses is in week 1, I'll have every week I'll have my objectives, but I'll have things like their homework assignments, MindTap assignments, for that matter, the lab activity. So let's kind of look how I kind of use things. So here you're going to see procedure 24-1, the craniotomy. And I'll go ahead and pull that up for us on the shared screen. And once you look at this, you can see that I highlight a lot of my content, which is, it's just a matter of highlighting it there. But my students will generally bring their laptops because they fully understand that if it's highlighted, that it's probably something that they should know, as well as the activities here that, they can go ahead and bookmark those as well. And then there's a great tool here that's called Study Hub. And it's really a great resource for the students, especially when they're studying for their cumulative final examination. They understand that, these are all the areas that we're going to be covering as in the material, and as well as, any bookmarks that I ask them to bookmark. So my goal here today is just to kind of show you, how to enter a video into one of your lectures. I think this is a really good resource for the students, because not only, did you provide that lecture, but now they're actually seeing the instrumentation that you reviewed, and then they're actually seeing, the procedure techniques that you discussed inside of the class, and then they can actually see how they're all being used. So I'm just going to go ahead and remove this video and just give you an idea of what it takes to set up a video. So you'll just find the content that you want. And this is actually a really good video, somewhat graphic, but we'll stop before it kind of gets there. And then all we have to do is highlight the link here, and then we'll copy it. And then we'll come down here and we'll hit the plus mark. And then where it says web link activity, we'll just go ahead and paste that web link inside there. And that's pretty much all there is to it. And then we'll just go ahead and put in the name of the video here. And it's that easy. So then when you're done, you can actually go over the video. So some other activities that I like to do with the class, I also like to use the the video quizzes. I think that are an excellent instrument activity, from the various different books. One of the things that I really like to, especially when we're finishing up the material, is the questions for further study and the case studies. The questions of further study really help me to identify, how well the cognitive skills of the class are, how well did they understand the material that we just covered, so can we actually sit down as a class, because I'll do this as class activities, not individual, and just to get a good idea how well they're understanding the content. As far as the case studies go, we'll actually discuss the case itself, and that's one thing. But then, as a class, I like to challenge my students to really help with that critical thinking aspect of everything, because now we understand, what the surgical procedure is going to be. But then I can ask the class, split them up, and say, well, can you make a preference card for this surgical procedure? What are those things that we're going to use? Can you talk to me what you're going to put on your nail stand for this surgical procedure? So they have to use those critical thinking skills, and I think this is an excellent tool to help us identify that. So I think that's probably a lot of information in a short time. However, if you would ever want more information or personal consultation, just contact your Cengage learning consultant. They would be more than happy to set us up so we could have discussion. I really thank you for joining me today, and I hope I see you in the future. All right, take care. Thank you. Bye.